Now, once we've acquired all of our measurements for our patients, we will then have the opportunity to plot those numbers in what's called a BMI chart, which stands for body mass index. Body mass index is a chart that helps the provider be able to determine at what risk this patient may be for developing health risk along the way that are in correlation to weight, I should say. It's not necessarily an indicator of health. One can have a high BMI, but yet be quite healthy, or someone could have a low BMI and have tons of health conditions. But it is based on height and weight, and it's just used to kind of help bring together any risk factors that might exist because of the weight. And so looking at our chart here, our body mass index, what you can see at the bottom is that it scales over in pounds, and at the side here, it scales up in height. So we have some averages here. 18.5 to 24.9 would be considered normal. So if we were to trace this graph over anywhere in pounds and work our way up here, anywhere in the pink area, this would be considered a healthy weight or a normal BMI. When we work our way towards overweight, that would mean any patient that's working their way this way over in the charting for pounds and working their way up anywhere in this area is going to be overweight. Same thing for obese, working our way over in the higher numbers as well as working our way up in height. There's a correlation between the patient's height and their weight and their possible risk factors. This chart also doesn't show, but it goes one step forward and it shows morbidly obese according to the body mass index. And typically anyone that falls in the over 40 range here in the chart, which is not represented here, would be at risk or at a higher risk for obtaining diabetes or heart problems. Again, not necessarily a direct correlation between the patient's height and weight. BMI can be unnecessarily unfair to individuals who are shorter because it brings the weight scale down. And so we just want to keep that in mind when we are looking at a patient's body mass index, that this is just used to help possibly indicate any health indications or any risk factors that may show later in the future. Now, we do have other measurements that may occur from time to time, and one of them could be a diameter of a limb. Think in the lines of someone having possibly a swollen leg, and we want to be able to determine the level of inflammation that they have in that leg. Best way to be able to do that would be to measure the leg that isn't affected and compare it to the one that is inflamed, and that would help the provider be able to determine at what rate the inflammation is occurring. We also can do measurements on wounds, on bruises, other body injuries as well. We would measure length and width. A good example for this is if someone has a tuberculosis test or a PPD Mantox test. That's the test that we use the wrist, and we create what's called the little wheel. It looks like a bubble. If that patient comes back after having that test done in 48 hours and there's still a wheel that's showing on the wrist where we did create that, we created that initial bump there, we need to measure that. And so that's a good example of other body measurements that we would do. Of course, the infant's chest circumference, the infant's head circumference we discussed, and then not uncommon to measure an adult abdominal girth or waistline.